Hi, everyone. Amelia Borland here from Higher Standards Caregiver Training. Welcome to this week's live 10-minute 2-Tip Tuesday. Thanks for anyone who's watching. Excited to talk to you live right now. And of course, anyone who is watching the recording afterwards, I sincerely hope that you enjoy this content and find it valuable. Before we get started, as always, this information is for educational purposes only. So if anything that I share with you here today reminds you of someone that you know, someone that you love, even yourself, and makes you think that maybe that person needs to seek advice from a licensed healthcare provider, then definitely please make sure that they are reaching out to the appropriate medical provider to get the evaluation and treatment that they need, because this is for education. So that said, let's kind of jump right into it. Today's first tip today, as always, is for caregivers. This is going to be a little bit different than the way I normally do tips. And that's because we are talking about something that can get kind of complicated, and that is about caring for someone post-operatively. So often, what I will do or demonstrate during one of these live 10-minute 2-Tip Tuesdays is I will demonstrate a specific skill or talk about a very specific concept. In this case, though, when we're talking about post-operative care, I would actually really truly be remiss in showing you something extremely specific. And that's because often the way that we care for people post-operatively depends very much on the operation that they had. So we are going to be talking about a very specific and common, incredibly common operation done all the time now. It's now done on an outpatient basis, which means that folks are going home ASAP, soon as they wake up. And more non-skilled care providers are being asked to step in and help fulfill this role of helping people transition to home when they've recently had this surgery. And so I know you're waiting for it. The surgery is a total hip replacement. Yes, if you can believe it, total hip replacements can now be performed on an outpatient basis. And so that means a lot of these folks who are getting total hip replacements are going home or back to their residence, wherever that is. And they very well may need some more help from caregivers, whether they be family caregivers or professional caregivers. And so that begs the question, what do these caregivers really need to know and understand if they are about to be caring for someone who just had a hip replacement? And as I said earlier, I would be remiss in telling you that this is exactly what you do if someone has had a hip replacement. And the reason is because what you do depends entirely on the surgeon's approach and that particular person. So there can be differences in whether or not someone else allowed to put weight on their leg, differences in the way in which they are allowed to move their hip. And certainly there are guidelines that are followed depending on the approach of the surgeon very commonly. And for my training clients, they have access to that kind of training on demand all the time. However, for the purposes of 10-minute 2-Tip Tuesday, really the most important thing to understand is that if you are a caregiving organization who is caring for folks who have had a hip replacement, or you're a caregiver caring for folks who've had a hip replacement, you need to ask the question and know, what is this person allowed to do? And what are they not allowed to do? And of course, there are different, depending on what the answers to those questions are, there are different strategies, tricks, tips that you can use in order to accomplish the tasks that need to be accomplished with that person. How are you going to help someone toilet? How are you going to help someone get dressed? How are you going to help transfer someone in a way that's not going to compromise that hip? But the most important thing to know is the baseline of what are they allowed to do? What are they not allowed to do with that new hip? And the consequences for this can be really, really high. If we move someone incorrectly after they've had a total hip replacement, then there is a chance that that hip will dislocate. And we don't want that. In fact, once someone has dislocated a hip replacement, they are at higher risk to dislocate the subsequent replacements that must be done again and again and again. It's something that if someone dislocates their hip replacement, they have to go back into the OR to have that repaired again. And I can tell you, unfortunately, over the course of my career, I have seen more than a handful of folks who are on their third, fourth, fifth hip replacement on the same side because they keep dislocating. So we absolutely want to make sure that we're not doing anything unintentional that can cause someone with a new hip replacement to dislocate that hip. Okay, so that is tip number 1 for caregivers. Let's move it along to tip number 2 for caregiving organizations. And this one, honestly, this is one that I had to learn the hard way in my own business too. And that is, you can't be an expert at everything. You don't have time to do that. So if you're a leader in, if you're the owner of a caregiving organization, there are so many layers to the organization, so many niches and areas of expertise to know about, things to be involved in. And the fact is that you just don't have time to become an expert in all of those things. You know, whether it is marketing, accounting, drawing up contracts, you would hire a lawyer to do that. Or for my clients who work with me providing caregiver training, you want to make sure that you are utilizing the limited number of hours in your day, focusing on the things that you need to do to really make your business grow and be successful. And a lot of times that means sticking to the things that you absolutely are in charge of, that you are absolutely an expert at. And then find those people who are experts in the other areas of the business to hire, to outsource, to bring them in order to allow them to elevate those levels of your business to the expertise of the expert that you hired. But the fact is, you just don't have time to become an expert on everything. So it is well worth the time to go and find those people who already are experts and who can bring that into your organization and make it grow and make it successful and make everyone around your organization and in it happier, healthier, safer, and happy to be with it. One more thing for today. It's not 3-Tip Tuesday. It's still 2-Tip Tuesday, but I wanted to make a quick announcement. Next week at 10 a.m. Central Standard Time, I'm going to be having a live discussion with Rick Waterman from LH Brenner Insurance. He is an expert, a specialist in home care insurance. So he and I are going to be having a discussion all about the trends that he is seeing in things like workers' comp claims, liability claims, and the things that you can do in order to help prevent those kinds of claims from happening to you in your organization. Save yourself a lot of time, a lot of money, and certainly a lot of headache and possibly heartbreak dealing with unfortunate situations that can arise, but that can be totally preventable. So if you're a home care organization in particular, and you are interested in kind of insurance trends in that industry and how you can prevent claims from being filed against your organization, then definitely make sure that you reach out to me. You can either send me a message over LinkedIn, or I will be dropping a link in when I repost this video. I'm going to be dropping a link into that post where you can click on that and then register and ask to join the live discussion with Rick and I. That is next Wednesday at 10 a.m. Central Standard Time. So I hope to see any home care organizations there that are interested in these topics. Until then, though, I will see you next Tuesday at 3 p.m. Central Standard Time. I hope you and yours are healthy and well. And until then, take care. Bye, y'all.